Whirlpools. Will whirlpools help? Well, some of the literature says that they can be contraindicated because you're putting a limb, whether it be the arm or the leg, in a dependent position. However, there are lots of different types of whirlpools, and if you get the position proper, that's fine, or maybe a warm tub or a hot tub. So whirlpools are not all that bad. You just have to be able to critically think and be able to teach the patient the pros and cons of their design of the whirlpool. Usually it's good for about 10 minutes, and in the clinic that may be appropriate. At home they might have a hot tub. Contrast bath, that's often a question that people ask. Well, it's advocated to avoid the extremes of temperature. There's been no research that says contrast baths help. But then again, there's not a lot of research on a lot of things that we do that is clinically relevant. And how can you put a relevance on sometimes just the importance of what the patient is feeling clinically that might be proven for them to be effective? So sometimes that in itself is priceless. And that's why some of the alternative approaches may work for some people. And you don't want to take that away from them if it works. But if you're going to use the hot and the cold, the contrast, they can do at home. Just remember to start out with having them almost identical in temperature. Gradually broaden the temperature difference between the hot and cold, just like you do with the desensitization. Start out pretty much all the same sensation and then gradually broaden the extremes. This can also assist, like we said, in building that tolerance to the heat difference. Something that can be very helpful is actually using Epsom salts. So you have the Epsom salts, warm soaks. And why does this advocate to help? Because of the magnesium. The magnesium actually can help with decreasing pain. It also can help with soothing. So so this is something that they may be able to do in their bathtub. They can maybe be able to do in their sink, or if they're doing your contrast bath, you may want to put some Epsom salts in it. Again, an inexpensive alternative that could help greatly. Ways to achieve proprioception feedback, because that's important, because we don't, when you're walking and you miss a curb, sometimes it's because your proprioception may be off. When you're asking a patient to touch the tip of every finger to their thumb and they keep missing, it's because their proprioception's off. If you ask them to reach for something and they overreach or underreach, their proprioception's off. Knowing where your body is in space should be able to do it with vision occluded, and we're having difficulty with vision. So again, that motor cortex. So let's try to give them that proprioception, and ways to work on that is through closed change exercises. Start weight bearing into that extremity. For the lower extremity, it may be a little easier. For the upper extremity, we need to create things. So you can, and as you can see here, we can just take a blob of putty and just have them press into it. You can do the Distro File. You can use balls if you can see different weights in different dimensions. And the lady with the red ball, she's actually pushing into the ball with a fist on a counter. So again, that's her closed chain exercise, proprioceptive feedback. Then you can advance it into a wall using both arms for the bilateral. And you can roll the ball up, press in for 10 seconds, roll the ball down, having total control. Lots of different things that we can do. As we talked about, we've all heard about the Distro File program for RSD. They advocate 3 minutes up to 10-minute sessions. Again, the Distro File can be very tough in the beginning. So assess it. They may not even be able to start with that. They may have to start with a sponge or a towel and then work up to the Distro File. Part of the program with this Distro File is carrying. Now again, you can carry lots of things, like I mentioned earlier, just using your hand to drink, to cook. Now let's look at how can we carry a load. So whether, and not just pushing like a cart in the grocery store. Maybe if they're in the grocery store, you can put a can of beans advocate putting a can of beans in their hand and going up 2 aisles holding it. At home, you might start with 30 seconds trying to carry rolled coins around the house. And then within a week, you want to see them being able to do 3 minutes carrying half a pound or a can of soup or something to that effect. Most soups are about 10 to 12 ounces. So again, using the environment and grading it with objective measurements, 30 seconds, 3 minutes, up to how many hours or whatever you're going to do. Some people advocate, putting heavier objects in their purse, putting weights on the cuff weights on your hands or your ankles. Those are all alternatives as well.